cardiovascular disease was not really a problem in Ghana some few decades ago, but with increasing lifestyle changes, we're having quite a number of them. 6 out of 10 deaths in adults in Ghana are connected to lifestyle disease, especially diabetes and hypertension. So it's really a critical subject. Now, between now and 2030, what we have set out to do is to increase access to healthcare through a national health insurance system. So in Ghana, we are working on rolling out one health check for every adult annually, at least one, which will be paid for by the insurance system. And so the hope is that a lot of adults would come forward, at least to get to check their blood pressure, get to check their blood sugar level, and for females, at least have some check on the cervix for adults. Now, when it is voluntary, sometimes you don't get a lot of people participating. So I think going forward, I always use the seatbelt example. In most countries, you are asked to wear the seatbelt because the science has already established that it saves life. It's not for the country to convince you whether you do it or not. And if you don't, you are fined or there are sanctions. I think going forward, we have to apply the same principle, especially in Ghana, based on the statistics. If 6 out of every 10 deaths in adults is connected to hypertension and diabetes, then we need to get to the place where in Ghana, if you want to drive, they check your eyesight before you are given the license. We need to get to the place where the law makes us know your blood pressure and blood sugar level, so that it is not up to you to tell us whether you are okay, but we as a government the state must know. Now, we have to know because once you get complications, it is our duty to come on board. And so we need to know early. And I believe that I was in South Korea some time ago. They screen the population and they have the picture of those who are pre-hypertensive, those who are hypertensive, and those who are severely hypertensive.